This is Janice Lopez from the International Organization for Migration, and welcome to the Migration Health Research Podcast. In this issue of the Migration Health Research Bulletin number 23, among the studies and reports that we feature centers on COVID-19, tuberculosis, kidney disease, reproductive health, and other topics relevant to migration and health. In this audio podcast episode, we talked to Professor Lucy Jordan from the University of Hong Kong about the health and social consequences among left behind children and caregivers in migrant households in Cambodia. Let's listen to Professor Lucy Jordan.
Despite the fact that migration is very common in Cambodia, like many places, in the world and definitely in Southeast Asia, there was actually very little known about the health and the social implications for children and families that are left behind in rural villages during the migration process. So the MICAS study set out with three primary research questions that we wanted to look at. The first is about the significant health and social consequences to left behind children and family members of low-skilled migrant workers in Cambodia. And the second was trying to better understand about how low-skilled migration may actually result in institutionalization or fostering of children of migrant workers. And the third question is about the interventions that could address these key issues that are identified through the primary research activities and how to develop and deliver appropriate and culturally and contextually relevant interventions in the Cambodian setting.
Can you describe for us the methodology that you have used for the study?
Certainly. So I think there's a few things I first want to explain about some key definitions, and then I'll go into the methodology a little bit more. So for the purposes of our study, we defined a migrant household as a household where either one or both parents were either domestic or internal or international, or what we call in a Cambodian context, cross-border migrants, for a period of at least 6 months at the time of the study. And secondly, we identified caregivers based on answers about their relationship to the interviewed children. And caregivers were classified into 3 types: a parent, a grandparent, or another kin in the families. And we also had 2 different cohorts of children that we were targeting. The first is the younger child cohort, households that had children aged 0 to 3. And then the second was an adolescent older child cohort with children aged 12 to 17. We launched a quantitative survey with a sample spread across 56 districts in 13 provinces in Cambodia, covering the geographic area where over 50% of migrants come from. And we used a stratified probability proportionate to size, PPS sampling approach, to select the location and the households for inclusion in the survey. Secondly, we conducted a series of in-depth interviews using qualitative methods and a purposive sampling method to approach children aged 12 to 17 years old who were living in residential care institutions for a period of at least 6 months to understand that relationship between institutionalization and migration. And additionally, from this quantitative survey sample, we took a smaller group of children and caregivers from those villages that were also included in a qualitative study for comparison. So we ultimately ended up with a sample that had 731 children in the younger cohort and 728 children in the older cohort.
Professor Lucy, at this point, I would like you to outline for us what are the key findings in terms of the health and social consequences to left behind children and family members of migrant workers in Cambodia.
We identified 10 key findings from the research study. I want to focus in on 4 of them. The first one that I want to focus on has to do with the economic disadvantages of migrant households. What we uncovered in the study is that despite receiving remittances, migrant households have significantly lower annual income than non-migrant households. And actually, the proportion is around $1,762 among the migrant households relative to 5,452 in the non-migrant households. So there's a very significant difference. And importantly, for health reasons, medical expenditures for children in the migrant households were significantly higher when compared to the non-migrant households. So this illustrated some quite potential risk around health among the children of migrants. The second key finding I want to highlight has to do with the poor coping capacities with food insufficiency. What we saw is that migrant and non-migrant households have a similar level of food security. So on that way, they look fairly equal. But migrant households had a much higher consumption-based coping strategy score, the CSI, which indicates more frequent and severe coping strategies are used to tackle food insufficiency. So this could have really potentially serious consequences for especially young children's development. The third key finding I want to focus on has to do with the elderly caregivers that are left behind and vulnerabilities there. One of the things that we found in many contexts in Southeast Asia, caregivers in households may be an elderly generation, grandparents caring for grandchildren. However, in the Cambodian context, compared to other studies that I have led in the region, the proportion of left-behind caregivers that were elderly was much higher. And so we really noted this vulnerability in this particular project. And it was mostly older women, so not just grandparents but grandmothers in migrant households that were showing a risk of malnutrition as well as poor mental health. And they also had a significantly higher rate of overweight. So we saw both types of nutritional risk, malnutrition as well as overnutrition, depression and anxiety compared to caregivers in the non-migrant households. And then the final key finding I wanted to highlight was about the gender differences in the health vulnerabilities. So we saw actually amongst the children that boys were showing a higher risk of malnutrition compared to girls. And they were also, the boys again, less likely to demonstrate emotional resilience, pro-social behaviors, and a secure attachment to their caregiver compared to the girls. So we really saw some quite potential risk among boys in these families. And then secondly, amongst the caregivers, we saw that female caregivers were more vulnerable to being overweight, illustrating depression as well as anxiety than male caregivers.
Can you cite for us some of the implications of this study to inform policy interventions of the government and other key actors?
So we spent quite a bit of time in consultation with a lot of different people on the ground in Cambodia during the project, so both with government actors as well as many different people in the non-governmental sector as well. And so we came up with a number of kind of context-specific recommendations for the way forward. We had two major thematic areas that we suggested focusing on. So the first is what we called caring for the caregivers. So having, noticed quite a few vulnerabilities here, we felt that this was a really important focal point. And in the consultative discussions we had, other people agreed with that. So interventions could be used to support elderly care provision. For example, providing respite for elderly caregivers, helping to establish a good social support networks at the local level, at the village level, providing greater acknowledgement of the elderly by the community leaders. For example, the form of caring for caregiver days that could be celebrated to recognize the contributions that they're making. Public education for the improvement of elderly's nutritional knowledge and dietary behaviors, and also efforts to help make healthcare more equitable for older people, especially for those in the rural areas. And then the second key area that we focused our findings on was around promotion of positive development of children. Having seen in our study that sort of the health dividends for children were quite mixed. So in some ways we saw some ways that children were experiencing some advantage from migration, but we also saw quite a lot of potential vulnerability. And therefore we felt that age-specific interventions should take developmental needs into account, and early interventions intervention and prevention could be considered to help avoid later challenges and promote child resilience, particularly to better enable children to cope with the migration-related stress that could be a part of what they are experiencing. And finally, also felt that helping to ensure adequate nutrition for every child was a really important factor in Cambodia. So this is not, just for the children of migrants, but for the community at large.
I just have one additional question, if you'll just indulge me.
Certainly.
I've noticed that the publication has been published in 2019. Can you cite if there is like any event or like a research dissemination that has been done, and if you can cite some outcomes?
So the report came out in 2019. So you can actually see, if you look at it in the timeline, the report came out relatively close to when, unfortunately, the pandemic then began to roll out. Before the actual report came out, we did a number of dissemination events in country. We had some very important discussions, with different government people there around, some of the possible things that could be done to help facilitate services for families. And actually in 2020, there was a paper that was published by the research team as well as one of the Cambodian research staff about kind of a quick look at what was happening in Cambodia, in response to the pandemic and COVID. So actually in that paper that was published, there was a focal point on looking at kind of what had happened since the project had been launched in country. And of course, the findings from this study and the vulnerabilities that were identified have created quite a bit of concern about how, what may be happening, in response to the changes of repatriation and various things that have been going on in the country. And in doing that paper, about a year later, we were able to see that there actually has been some beginnings of change in regards to helping to support kind of a more localized level of community support in regards to paraprofessionals, so people in the community that are trained to take on a bit more of a community support leadership role in the rural communities, which actually benefits the overall rural communities, but especially as well these households of migrants that may be experiencing particular needs because of the various challenges and adversities that they're facing in regards to having a higher care burden and fewer adults there to help to take care of children. So I think we were actually quite pleased to be able to see that this data from this project provided a sort of a baseline, a snapshot of what was happening in country at the time in 2018, but some work that was done quickly, in 2020 in regards to gathering information. We could see that there has been some beginnings of a pathway towards taking on board some of these ideas about more localized responses to families that are in need in Cambodia. So that was a very, kind of promising thing to see. And we also continue to hope that we could get a bit more of a deeper look again about what's been happening since the report was initially launched in 2019, because so many things have changed, in the intervening years. And we hope that this study can be used as good foundation to be able to talk about things that have, changed in positive ways, but also perhaps, some new barriers that have come in force because of the pandemic.
Thank you very much, Professor Lucy. And thank you all for listening. Please feel free to share your feedback with us. See you on the next podcast.